Hi, everyone. I'm Aliza Sherman. I'm the CEO of Ellementa, and this is our monthly webinar. Every month we have a free webinar where we invite a very informative, very qualified expert to talk with us about whatever the topic happens to be. I just wanted to remind everyone that this Sunday we also do a book club. So we interview authors about their books and about their careers. And Sunday we have Amanda Siebert, The Little Book of Cannabis. So that's Sunday, the 23rd of February. And a reminder, you're all going to get a recording of this afterward. So thanks for being here. I wanted to say hi, Dr. Sheena.
Hi, Aliza.
All right, so we start off with our video so you can see that we're human, that we're real. Some of you got here early, so you see all the behind the scenes stuff. But now we're going to jump over. I have to click a few buttons and we will do the magical slideshow, the slide presentation, and get through a lot of information in a short amount of time. Then I will make sure we have enough time so you can ask your questions. But you can always, in the chat function or even the Q&A function, start to put your questions in there, and we'll kind of pick through them as we go along, and then in the Q&A time, we'll get to as many as we can. So we're going to turn off our video right now so it's not distracting, because we've got some really great slides with lots of good information. I'm going to, let's turn our video off. And give me a few clicks. 1, 2, 3, 4. Can everyone see that? Somebody's going to have to say something. Erica, can you see it? Is it showing?
Yes, I can see it also.
Okay, you can see it too. Great. All right, super. Because I can't see anybody doing text chat anymore. All right, so this webinar is brought to you by Ellementa and MyJane. I'm going to tell you more about them in a moment. And our topic is Cannabis and CBD for Intimacy. We keep switching up the title. It could be sexual wellness, intimacy, women's reproductive health. It's kind of all going to be packed into this evening. Our goal today, empower you with better information about cannabis for health and wellness, and also to quickly introduce you to the Ellementa women's wellness community in case you don't know what we do. But first, let me tell you about MyJane. MyJane is centered around women wellness. They look for quality products. They have this very good vetting system for the products that they carry. They are into fun and empowerment. These products are put into boxes with different themes, and I think we're looking at the romance box. There's a sleep box as well, and these are all CBD. They all have COAs, the Certificate of Authenticity. A lot of them are women owned or very, very female focused, and just a curated box that you can order, subscribe to. And I've seen these in person. It's a little hard to tell from the photo, but I've seen them in person and they're really terrific. They have inserts with information about the products and the company. And it's just a great way to sample different things as well. So this is the romance box. You can visit myjane.com and get more information. And we will have an offer in a moment. Well, actually, toward the end of the webinar. Now, there's also some things that you can win. We do this every so often, and we happen to have a giveaway this webinar. And it's a product called Vela from Mana Molecular. And they're based in Boston or in Massachusetts. And they are going to give away to one lucky winner their breakthrough topical serum to enhance female sexual pleasure. So we have given away products like this before. And since things like this have CBD in them, if you are in Canada, we can't send you this, so we'll send you some alternative gift. So if you are the winner in the States, we can ship this to you. Again, anyone overseas, I apologize. We'll have to just do a non-CBD product for you, but we'll get you something good. However, if you are in the States and you win, this is our prize today, and we'll pick a winner at the end. we're talking about your wellness journey. That's what Ellementa is really focused on, wellness. And we happen to have a lot of experts that we tap into to get information about cannabis and CBD because everyone has questions. We have events where you can connect with those experts in person. We call them gatherings. They're in cities around the world. I think we're in about 55, 60 cities now. We partner with women, we share in the revenue, and we bring experts, good information together. And we try to help you identify the products that might be right for you. We bring to your attention quality products. So that is really, in a nutshell, who we are and what we do. One last thing, I came out with a book with Dr. Junella Chin. It's called Cannabis and CBD for Health and Wellness. So we create content and we've been able to put it into a book. I'd like to know a little bit more about you. So here's our quick little poll. And then Erica throws it up there. Look at that. Have you tried cannabis for sexual experiences, sexual enhancements, reproductive health, sexual pleasure? Have you used cannabis specifically for your lady parts, as my business partner likes to say?
I like that.
So give you a few more moments. You can literally click and vote. Let us know yes or no. It's private, it's anonymous. We won't judge. Trust us. And we'll probably talk about our own experiences. All right, let's see. We got some people voting, putting in their answer. Oh, 75% say no. All right, well, let's move on to the next slide. We've got a lot to tell you. So first, our very special guest expert is Dr. Sheena Vanderplug. I asked how to pronounce her name because everyone always says my name wrong. So I'm always trying to be super careful about that.
I appreciate that. Thank you.
Yeah, we talked about that. So Dr. Sheena, I will give you the floor for a moment to talk a little bit about what you do.
So first of all, thanks for having me on. And a little bit about what I do as a naturopathic physician. So for those of you not familiar with naturopathic medicine, it's more of a holistic approach compared to conventional medical care, meaning we look at things like lifestyle factors, such as nutrition and movement habits. And we go through health history, people's relationships as it contributes to mental, emotional aspects of health, environmental factors. And then we also look at, conventional lab methods and genetics and hormones and nutritional assessments to help people optimize their health. And a huge part of what that means is we're treating the whole person, not just chasing diagnoses or managing symptoms, with a huge emphasis on prevention in, trying to optimize quality of life through contributing to health. So hopefully that's a good little intro.
That is, and
Awesome.
that's, I don't know if I mentioned this, but my sister's a naturopath. She studied in Portland, Oregon. Yeah,
perfect.
So
You're familiar.
I am, but it's
Yeah.
always good for everyone who is out there, who is listening to this and watching this, who is not familiar. And that was a really great overview of it. And speaking of overviews, there's a couple of slides that I'm just going to quickly go through for anyone who is really a beginner. We like to make sure we set the stage so everyone has a basic understanding of what is in cannabis that is working with our bodies and brains. So the first thing I want to make sure everyone knows about are cannabinoids. So the cannabinoids are chemical compounds in the cannabis plant. And cannabis happens to be incredibly abundant, full of cannabinoids. Now, cannabinoids are in other plants as well, like echinacea, for example. But cannabis has more than many of the other plants out there. Over 100 have been identified. And I say identified because they keep on finding more. In fact, in March, Emma Chasen is going to be doing a webinar with us and talking about the new ones that were just identified. So this is pretty fascinating. We call
exciting.
We call cannabis a super plant because it has so many cannabinoids. Now, our body produces natural cannabinoids as well, called endocannabinoids. A plant cannabinoid is phytocannabinoid. And by the way, THC is the most well-known cannabinoid, but there's also CBN, CBD, of course, which is becoming incredibly popular, but CBG, THCV, THCA, and we'll talk a lot about that next month. There's also terpenes. Now, there's also flavonoids and other chemical compounds, but terpenes are like the aromatherapy of cannabis. They help determine smell, taste, and color. And terpenes are also in other plants, in fruits and vegetables. We are consuming terpenes very often, so they can provide different effects. They can fight bacteria, they can lift your mood, reduce anxiety. Some are sedating. And if you look at the pictures on the screen right now, upper left side is pinene. You see that in conifers. Well, pinene is also in cannabis. Limonene in citrus fruits, also in cannabis. Linalool, this is like one of my favorites, in lavender, can also be found in cannabis. That's the one that gives you a little bit of relaxation or sedation. Myrcene, also in mangoes. Now in cannabis, here's a little tip, since we're talking about women's health. I learned this from Dr. Janella Chin, that myrcene and too much myrcene is not good for menopausal women. So keep that in mind when you're looking at the contents of your cannabis products. And the last thing is the endocannabinoid system. Our body is made up of many systems that we all know about: digestive, respiratory, nervous system, also our reproductive system. Laid over all of that is our endocannabinoid system. And this was identified rather recently, in 1989 and 1990. It's a whole constellation of receptors in our organs, our tissue, our brain. And these receptors receive cannabinoids, and all the cannabinoids in cannabis react with or bind to various receptors. So there's a lot of science behind this, and a lot of research being done in Israel, especially about cannabis, the endocannabinoid system. And that's why what we're going to talk about hopefully will make a little more sense why cannabis is working for so many people, including so many women. So I'm turning it now over to our expert, Dr. Sheena. Please, let's talk about female reproductive health.
Okay, so that was a perfect segue, because the endocannabinoid system, although the research has largely been absent because of prohibition, what we're starting to recognize is that it's the most prolific and integrated system of the body. And that's why it works so well. And that's not my quote. That's from Dr. Vincenzo DiMarzo, by the way. But, you know, when you're looking at the whole person, it's hard to imagine that this isn't intimately tied in, especially because so many people are finding relief from various health concerns, conditions, you know, throughout their lives in various ways. So we're starting with, like, from the top down, some of the most common conditions that women are using and looking to cannabis or CBD related products for include PMS, PDD, chronic pelvic pain, things like PCOS, endometriosis, perimenopause, menopausal symptoms, postmenopausal symptoms. And when I'm thinking about this, cannabis can really, it seems, can really help enhance sensual and sexual experience. So whether people are dealing with chronic pain or low level libido, or, you know, stress in their lives, vaginal dryness, insomnia and hot flashes, like all of these things, regardless of the diagnosis that you are given, it's like there's all of these other factors related to that I think contribute to benefits from cannabis and how they can be used in a variety of ways.
Well, I agree. And I have to say, I have personally experienced a lot of the things that you've described, and have found that cannabis and or CBD or in combination have been very beneficial. So why is that?
That's a good question. So the research is not exactly clear. Like to date, we don't have any direct clinical trials saying this is how this works and why. There's really no clinical research proving that cannabis has any direct influence on sensual or sexual experience. That being said, there are some interesting it's like questionnaires, you know, really it's a lot of community science, I think, that's contributing to what we're investigating here, because it's like the research that does exist, it's a lot of animal studies, but mostly surveys and kind of observational research.
Where people kind of identify themselves.
Right. So very
cannabis
subjective.
users. Yeah. Okay.
Exactly.
Okay.
And so why can cannabis work for women? Well, it's more of like, why can't it? Right? I mean, we're wired for it. And with the ECS being so responsive, especially in how it interplays with hormones and mood and all the things contributing to the topic of like sexual health and wellness, we're wired for it, is really like what the research is showing, whether we're ingesting it, using it topically, suppositories, whatever that method is.
Well,
and
I think yeah, I was just going to say it's pretty interesting doing the research for this to find out that our reproductive organs, our whole pelvic area and region is absolutely full of receptors. Now, I did forget to mention when I was talking about the endocannabinoid system, the two most well-known and researched cannabinoid receptors are called CB1 and CB2. And CB2 tends to be more immune system. CB1 tends to be throughout the body. But to know that there's such a concentration in all of our nether regions, all of our vaginal,
right, where there
uteral,
in the uterus, and then even in the hormone secreting organs of the body. So things like our ovaries and like thyroid. So, you know, all of that definitely it responds not just to the hormones, but also the endo and phytocannabinoids that we ingest. There absolutely is interplay there.
Excellent. So I talk a lot about how cannabis has helped me post-menopausal in terms of sort of sexual wellness. It's one of those topics that not a lot of people feel comfortable talking about, which is great that we're doing in a webinar. But let's talk a little bit about sex now. Get right down to
all the taboo, right? It's like, starting from Reefer Madness days, it really set the stage, when cannabis had been associated with like sex crimes and insanity. And now today we're like reflecting on that. And now we're kind of shifting into what like Ayurvedic medicine had historically looked at cannabis as, which was as an aphrodisiac. And so that's I really like the spin that's starting to take place, because incorporating cannabis into sensuality and sexual experience, I think really lends an opportunity for people to have a better experience with intimacy, being present in the moment, comfortability, experiencing enhanced like anticipation, excitement, pleasure, and being able to relax. And then beyond that, on the slide here, it's referring to, contributing to and working with the hormones in our bodies, such as oxytocin. We can look at like, there's various stages to like a sensual or sexual experience. And, it starts with like, is the desire there? Is the arousal there? Can you climax? And how do you feel after? And although all of these phases may vary, repeat, or be absent, or be in any sequence for a woman, because we're all wired differently, I think, identifying like where it is in that, like being able to be honest with yourself about what is it? Because it's like, the more we can be honest with ourselves, the more we can start to share with healthcare providers and also explore cannabis in a really more like optimal way.
Well, there's definitely these physical interactions, but you also started touching on the mental aspect of being able to enjoy sex at any stage of a woman's life.
Right.
So there's that mental piece you were talking about, relaxation and
Absolutely.
reducing anxiety. And you said this during our prep. Wired and tired can get in the way of good sex. So,
Right.
so
I love that phrase, like wired and tired, because so many women, so many of my patients, you know, we're juggling so many things. And it's like that low grade hum of all the busyness of our lives, it absolutely has an effect on our nervous system and in turn, our endocannabinoid system. And a term that I want to kind of introduce here is like the endocannabinoid tone. Right. So if THC acts as it's been described as like akin to THC, right? So anandamide is the bliss molecule, and then 2AG is kind of like the CBD of our body. And there's no doubt that stress, anxiety, inflammation, all of those things that contribute to the busyness in our lives absolutely manifest in our minds and in our body. And that so readily can get in the way of our ability to be like emotionally present, to connect, to even get to a place where we're even open to the possibility of arousal, you know, because it's only in that state of where your nervous system is in this parasympathetic state to rest and digest, to feed and breed. There needs to be that segue and that balance there.
So you gave me the stat and we have it here on the screen.
Yeah, perfect.
Regular cannabis users have 20% more sex than non-cannabis users. And this is something out of Stanford. So,
right. And it wasn't just more sex, but it was better sex, which was cool. Like when I was reading about that. But again, that was kind of a observational study that came out, but I was like, awesome, because now at least they're starting to open the door to that in a real way.
So we've kind of gone over some very specific needs that or things that need to happen for women to be able to enjoy sex, to be able to feel good just in general. Be pain-free is a very good one. Be less stressed, less anxiety, have just sort of more sensitivity to the experience. Definitely less anxiety, and also more creativity. I like that one. I think it lowers your inhibitions a little bit as well. So
you can have fun with it.
So you can have fun with it. Exactly.
Right, because it's like if we're not having fun, then wait, what?
Yeah. So there's many different ways to take cannabis, and a lot of you probably who are watching it or listening today are very familiar with the various ways of taking it in. So what we want to do is maybe talk about the different ways to take in cannabis, the different forms that cannabis comes in, but let's apply it specifically toward women's sexual wellness and sexual pleasure. So let's not just smoking and vaping. People have a sense of what that is, but how does that and all the other different ways.
How do you tie that in?
How do you tie that in? So let's really quickly, I'll just go over and then I'll give it back to you to take one at a time. So pulmonary is one way to take it in, and that's through smoking or vaping. Also there's dabbing, which is a sort of a very high heat, sort of pure vaporizing technique. There's taking it orally, so edibles, tablets, sprays, oils, anything you put into your mouth. Everyone calls these drops tinctures, but tinctures are normally in alcohol or sometimes in glycerin, but alcohol tinctures aren't as common in cannabis, only because if you're taking it orally, it can burn your mouth. It has a burning sensation. So it's usually an MCT oil or something like that. Topical and transdermal, on the skin, on the surface of the skin, or on the skin and then sinking into the bloodstream. And transmucosal, so mucous membranes, the mouth, the vagina, the rectum, all of the mucous membranes of our body can absorb the medicine. So I'm gonna turn it back to you, Dr. Sheena. Smoking and vaping and women's health.
So of course, as a doctor, I'm going to say smoking and vaping, like combustible material is never a good thing to invite into your lungs. As a doctor, you know, I need to say that. That being said, like the benefit of seeing patients use it is the rapid onset, right? So, and then that's also where like knowing your dose. It's nice if people have been taking notes on how their system responds to what dose of things. This, in terms of like sexual health and wellness, if we're talking about in the context of intimacy, sometimes people will consume in this way beforehand as like a part of like foreplay, you know, to like get into a space where they're a little more relaxed, a little more euphoric, a little more open to the invitation of a sensual or sexual experience. So it can just kind of quick onset, and that's how that I feel like would be best utilized.
And also the analgesic quality of it.
Sure, especially in patients with chronic pain. That's often when I see people relying on it most readily is like, especially if pain is intermittent, but you know, like things can make it exacerbate. So they have like a serious episode or something, then smoking or vaping reliably can like knock that out while they use other things like edibles or topicals afterwards.
Well,
like a layering effect.
Let's talk about edibles and that layering effect too. I don't want to gloss over that. The idea of utilizing something that's a rapid onset and then something else that takes a little bit longer to kick in.
Sure.
Is helpful.
It is. And with edibles, I love that the start low and go slow is on this, because when consuming a cannabis product orally in this way, it's going through first pass metabolism of the liver. And a lot of people experience up to, I think the estimates are about like 5 times intensity once it's processed in that way. So the effects can be a lot stronger than you would expect compared to like a sublingual or some other method of consumption. And because you also included less precision, because it's not like something you can drop dose or is metered out in a really reliable way. So eating half of a brownie or something, it can end very badly for some people. And it's unfortunate, not fatal, but it can be really uncomfortable. And then that's definitely not going to improve the mood, right? So it's easy to kind of overdo it. Yeah.
And for anybody who doesn't know this, I always like to point out that if you are feeling too uncomfortably high because you have consumed THC, particularly the edible, or just too much of any form, and it's the antithesis of what you want to feel, some drops of CBD oil under the tongue and let it absorb through your mucous membranes in your mouth, sublingual glands under the tongue, is a good way to sort of temper that high, because the cannabinoids interact with each other and CBD tempers THC.
That's right. I call it the e-brake. Like it just, right? Like, let's just slow that down. Yeah, I like that. That's good advice. Yeah.
And tablets, capsules. I mean, there's a lot of companies now that are getting into an almost sort of pharmaceutical style manufacturing process to take what's in the cannabis plant and convert it into things that are more familiar to a lot of people, pills and capsules. How is that for women's reproductive health? I mean, when would you use tablets or capsules?
That's a good question. I think I wouldn't use a general statement, because like we know everyone responds differently. And the thing about anything orally with absorption, like even with vitamins and supplements, you're only absorbing a fraction. It's like I've read different things from like 20 to 40% is what you absorb of what you take. So if you're really trying to be accurate in your dosing and what's bioavailable, that's where some of the sublingual things I think can be more effective at titrating and measuring doses reliably. That being said, you know, here it says like even dissolvable or sublingual tabs, like that would be a different situation than a pill that you take or swallow in terms of absorption.
So, yeah,
but it's similar to edibles, I would think, with longer duration of onset and then also for the experience. So longer lasting effects, you have that there.
Yeah, I also think of a place for tablets or capsules, a form like that, is microdosing.
Sure.
Because it's a lot more precise. They are metered out, and they tell you on the label per tablet, for example, how many milligrams of THC. And so for those who want just to feel sort of a lighter relaxation without being heavily high.
Yeah, without intoxication. You're managing symptoms, feeling more comfortable in your body, in your mind, whatever it is, and not having a completely intoxicating effect. So yes, absolutely.
Yeah, so that's where I think that something like that could fit in. And if somebody has chronic pain as well, microdosing throughout the day or on a regular basis could then mean that that relieves so much of that discomfort. So when it does come to sex, you're feeling a lot better because you don't have that chronic pain hanging over you.
Right.
So, and infused oils, this is kind of the most popular for CBD, not as much, or at least I haven't encountered a lot of people who are taking THC infused oils, unless it's more on the medical side. But how are infused oils helpful for women's sexual wellness?
And I love the idea of like tinctures and infused oils because it's using traditionally practiced and used forms of plant extraction. So for the tinctures that are oil-based, it's actually an infusion. And what I love about it is the versatility. Something like an infused oil can be ingested. It can be rubbed on sore muscles or over the body, joints, or it can be used as a lubricant. That being said, not compatible with latex if that's part of your, protocol. So that's just an important thing to note. But I just think the versatility of it. So for people that are dealing with chronic pain or vulvovaginal pain or pelvic floor tightness, whatever it is going on, this kind of product could be used in a variety of ways, and it doesn't have to intoxicate you to get the effect.
Right. So that was a question that I had is, everyone's wondering when you're using something vaginally in particular, it doesn't get you the head high, right? I mean,
well, supposedly, theoretically, it's a mucosal membrane that could, but that's not the feedback and consensus I've been getting from people that are using this and my own personal experience with using it. So, whether it's vaginal suppositories, rectal suppositories, there's really not the fact that it bypasses a lot of that. So you don't have an over intoxicating effect. That being said, depending on the dose, and every body is different, but theoretically vaginal absorption could potentially. So it's, again, maybe start low, go slow. If you are a very sensitive person, you might be one of the few that okay, that was enough to get you into a place where you're feeling the effects in a psychological way.
Got it. So topicals. Now,
love them for this.
Yeah. Yeah, me too.
Vulvovaginal wellness, right? The topicals are amazing because CBD, THC specifically, for women and also men, has been purported to increase blood flow, enhance the intensity and duration of orgasm. It can make sex, whether it's vaginal or anal, more comfortable. And so I just think as part of sexual wellness and experience, this is just a really nice way to incorporate cannabis for people, especially those that are maybe a little bit less interested in oral consumption and other things, right? Even if it's for pain or something.
Well, so when it comes to topicals, particularly sexual wellness or sexual enhancement topicals, it does come in a number of different forms. So it could be a cream, like you said, it could be oil.
Yeah, it could be a tincture. It could be a salve. It could be, And salves sometimes have like, cocoa butter, different, like, I don't know about waxes and the vagina, because like topical salves, not all of them I would readily place on that area.
Right.
Mm-hmm.
Right. So you really would want to buy a product that is
designed with you and your vulva and vagina in mind.
Yeah. Right. Yeah. So what you put on your face is not necessarily what you put everywhere else. But there's also sprays, which often are oil-based. And as you mentioned before, if you are using condoms or anything with latex, you want to just make sure you see if it's safe for, but a lot of these oils would not be safe for.
Correct.
And I did say that I would mention something on the personal side. I have tried THC sprays and CBD oils. And the combination is incredibly helpful because the CBD is an anti-inflammatory. And so it really does help with inflammation and irritation. It can help a little with the analgesic effect. And then the THC is very good with, it's interesting because it can be an analgesic and also in a sense, as you said, it increases blood flow. So it is almost a stimulant in a way. It does both. It makes you more sensitive to the touch, but it also takes away that pain from,
or tension, like as a muscle relaxant in that way too, because sometimes tight muscles can restrict blood flow. So if we're holding a lot of tension in our pelvis, or that can also be part of what's going on there too.
Yeah. Oh, interesting. Well, that makes a lot of sense. So definitely look for the products meant for the particular parts.
Yes, because pH balance, it's very delicate. It's a very delicate ecosystem. So we want to be introducing things that will, be restorative and helpful, not disruptive.
Yeah, definitely. Yeah. And so suppositories, you did mention suppositories. I think in our culture, we don't, meaning Western American, US culture, we don't tend to turn to suppositories until later in life. It doesn't often come up as your most common way of taking in cannabis or CBD. And just suppositories in general are often associated with older age. But it's a great delivery system for cannabis and CBD, right?
It is. And the feedback I've had from a lot of patients with chronic pelvic pain, it really helps. Intravaginal suppositories can be a game changer. Also for patients with like fibromyalgia or just really bad menstrual cramps, like this can be a win and slam dunk in terms of regulating symptoms. And depending on dosage, again, like oftentimes it doesn't have a completely intoxicating effect. It's just relieving symptoms. So, and because of the transmucosal delivery, I think it has more, my theory is that it does have a very effective local effect without completely intoxicating.
Interesting. So I know we have a review on our website of a product that one of my business partners, Ashley Kingsley, had tried herself. So she and I are both sort of in the same stage of life. Our other business partner, Melissa, is in much more of the fun enhancement, and I don't have that pain yet stage of life. Lucky her. But suppositories are not something that I've tried. So it does seem like a lot of it too on the THC side, unless somebody manufactures it in the state where you are, where it is legal, it's a little bit harder to get, although you can make your own.
That's true. They make molds, and I know patients that make them just for, the cost-effective nature of it. And so that's definitely an option. And they're not difficult to make. It's just a mold in a refrigerator, some, food grade organic cooking oils, and you can definitely, that can be a DIY.
Yeah. And if you are making your own oils, one of the products that we really recommend is the Levo, Levo, the Levo oil infuser. So you can infuse your own oils, and then you can stick them in the fridge, and then you can stick them where it counts.
Right.
So overall, you look at the whole person, not even just the whole body, but the whole person, body, mind, spirit,
Right.
inside and out. So if we're really talking about good sexual wellness and sexual health, good sex, what should women be thinking about?
I would consider, I love that question. Thank you. Because I think really, it's labeled as like sexual dysfunction. And it's something that unfortunately, 40% of women deal with some level of sexual, quote, air quotes, dysfunction. And they go unrecognized and often untreated. And when I'm looking at sexual health, I'm looking at, what kinds of obstacles are existing that are interpersonal. So, with ourself, like how are our self-care habits? How is our lifestyle? How is our sleep? What are we putting in our body for food? How are we moving our body? Because I really do think movement is medicine, right?
Mm-hmm.
And how are we helping ourselves to actively rest? There's a lot to be said for the work that Dr. Dispenza is doing around like relaxation and consciousness. I'm a huge advocate of restorative yoga practice, just because I really think that helps improve our vagal tone, which our vagus nerve is this wandering nerve that goes through our whole body, and it's intrinsically related to our ability to rest and relax. And I'm sure that as we learn more about the endocannabinoid system, we'll see how that overlaps with the nervous system and its parasympathetic activity in a way, because it really does need to be considered through a thread of our sexual health, especially our sensual sexual experiences. As I had mentioned earlier, it's, is our mental game in a place where we have the desire? And then are we in a physical space where we're feeling aroused? And then can we get through all of these steps, and not just get through them, but enjoy them, celebrate them, and, just relish in some of the beautiful things we have offered to us as being human. Really, I feel like sex is one of the best ways for us to, I use the phrase like get high on our own supply. What we're learning about the cannabinoids is, these receptors exist on neurons with, serotonin, dopamine. And when we're looking at sex, that means it's also related to things like oxytocin. So I think overall, like doing all the things you can do to support the integrity of all the things contributing to your health ultimately would contribute to a more enjoyable sexual experience.
Well, I like that. We have one more slide before we're going to get to questions. And you were talking about the endocannabinoid system. How can we nourish that? What can we do to really stimulate the endocannabinoid system so that it can better regulate, modulate the rest of our systems in our body?
Okay, so top down. This might be a long one, so you might have to cut me short. But nourishing the ECS, starting with supporting a healthy circadian rhythm. So what are we doing to support our energy and our rest function? Because so much happens in our sleep. And if our sleep is not restorative, it's like, how are we going to wake up the next day? Tired, right? So it's like the foundation of nourishing the ECS, I think, is really carving out time so you can really relax consciously throughout the day, whether that's meditating, yoga, some form of relaxation where it's just like an active break from everything, and then supporting healthy sleep function. So not looking on our phones and being on screens attached to technology up until the very moment that we go to bed. I usually, stop looking at my screen about an hour before I go to bed, just so I'm not getting that blue light, because that's a waking stimulant. But, like little things like that to just biohack and support the foundation. And then also food as medicine, super important. We are what we eat, and not just what we eat, what we absorb. So it's important that people, take the time to really sit down and eat. So many of us are on the go that we eat out of convenience. And then it's like, if we're in a hurry rushing around all the time, are we really absorbing what we're putting in? Even if we are making healthy food choices, just questions for thought, and yeah, I think also healthy relationships, feeling loved and supported by yourself, like showing up for yourself, like do something good for yourself every day that makes you feel great. And working with your partners and loved ones so that you have healthy relationships, so you feel supported and expressed and held. I think that's all really important for our mental, emotional health, especially in the relationships where we're intimate and sensuality, sexuality comes up, because it creates like an environment that supports, you know, a feeling of like safety and being held. And I think that's a huge foundation of, you know, exploring sex and sexual wellness.
Well, I agree with everything you say. I'm very guilty of not really taking care of myself. I think we often are over-reliant on vitamins and supplements and thinking there are quick fixes. But I do also believe and have learned and have experienced that by taking a little bit of a full spectrum CBD oil, it has been helpful to me, particularly under stressful situations.
Sure.
When stress is just so high, I used to feel the effects of that. And now I think when I'm supplementing in these really tough times, then it's very helpful to me. So I agree with all of it. And I love the holistic approach. I would never say just, hey, take some CBD or take some THC and all things will be better.
Right. But
there
it's a great tool. It is an amazing tool.
Yeah,
it absolutely is. And as the thing about like assessing endocannabinoid tone, it's like, it's really hard to make blanket statements, right? Whether it's anxiety, inflammation, autoimmunity, about like what to take and why.
Right.
And so it is a lot of trial and error, but like finding out where you are, and then you have those tools to reliably lean on, you know, in addition to all the self-care that I mentioned. Yes.
Yeah. And that's something that we often try to remind everyone. This is very individual. Plant medicine is also not always super precise, even with the more precise dosing methods. It's still going to be a lot to do with you, your individual body, your individual brain, your systems, and the condition of them. So we want to get to the questions. I see some questions coming in on the Q&A function. I'm going to get out of this sharing screen mode. We're going to go back really quick into video mode. And Erica has been looking through. And
we have some fantastic questions.
Well, then let's get to them quick because we've got about 10 minutes.
Let me just pull up.
I want to be super mindful of time for everybody.
Pull up Dr. Sheena's video. Hold on.
Well, meanwhile, I'm going to go into the Q&A and I'm going to start.
You're going to look at some? Okay, I'm going to start reading one. Okay. Let's see. Glasses.
Sorry, yeah, I know. Sorry about my glasses. My reading thing is down here, so. And
okay.
I don't want to.
So I'm just going to read the quickest and easiest one to start. Edibles in the form of gummies would be considered pretty precise in dosage, wouldn't they? And so we got to double back to that topic real quick and hit upon that. Go for it.
I would say yes. At least with the products that are available in Oregon, they're all tested through laboratories, so you have a pretty good understanding, and there's a wiggle room. It may be within 10%, but at least you can gauge dosing reliably. So if you theoretically cut them in half or ate a whole, yes. The thing is, we don't know how much we're absorbing. Right. That's like the caveat. It's what.
Yeah. And also you have to be really careful about what products you use, what company, what brand. Not all of them are as precise. So if it's THC, there are a lot of rigorous things they must go through in a legal market in order to get onto the shelf. So that's great. CBD is not regulated in the same way. So if you're taking gummies for the anti-inflammatory and CBD benefits, you don't really know what you're getting. So also just be really careful brand-wise. To make sure to check their packaging, at least, again, in legal states, they are regulated. This one is super interesting. I'm going to try to read it like this. I like the topical called Muse. It's a sensual enhancing spray, but her husband is concerned that if they are using it during intercourse, he's going to run the risk of testing positive for THC if a random drug test happens. I will tell you where he works. He works at NASA. So they're going to do these random drug tests. Anyone who works in the federal government knows, or government in general. I think Hope, it stays with her. She hopes it stays with her body, but she doesn't know. Is he going to test positive? She's using 10 milligrams of spray. You know, okay, so I have to say, we get this question all the time. Will I test positive? And in a case like this, will it pass through? And will he test positive? It's not our place to tell you what will and will not happen. It is obviously a risk no matter what. But now you can answer, Dr. Sheena. Do you happen to know?
I don't know. I haven't had an instance where it's like, we need a community service experiment about that, a community science experiment, because it is an interesting inquiry. Because I know people have effectively used topicals and even THC containing topicals, like on sore joints or muscles, and they did not test positive. But when you're exploring things like mucous membranes, there's always that potential of transmission. So unfortunately, I mean,
we get that.
There's always potential.
Every single event, and we always say that there's exactly. So you've just got to be.
We
very
need
careful
research.
About it. We do. We need more research on that. Well,
I would say
crowdsourced. Well, one good thing to do is find the products that are compatible with latex condoms. And I believe there's a product in California, if you're in California, called Velvet Swing. I think it's also available maybe in Oregon, which says that.
I thought it was Seattle.
Maybe it's Washington State and California. It's in 2 states, I know. So just check the label, because if it is compatible with condoms, I mean, you might have to go that route to protect. Here's another one. I work full time and use capsules or make my own in order to take it in the workplace. I also have bad hormonal reactions due to narcotic use. I haven't really moved away from those reactions while on medical marijuana. Any advice? I do see a compounding pharmacist to supplement. Her question is using capsules, bad reaction, move away from those reactions. If that's your question, Patricia, if you could maybe clarify a little bit. I'm not quite sure what you're asking, but here's one. Do you recommend a particular product for weak pelvic floor that leads to UTIs and pain? So weak pelvic floor, can cannabis or CBD help with weak pelvic floor, or it can help with pain?
And hypertonicity. So that's a fancy way of saying muscle tightness. So if there's pelvic floor tension, that's kind of like even with topicals, with chronic like tight muscle pain, it's like it can help relax. So
but the opposite, the weak pelvic.
Right. Instead, for the weak pelvic floor, I think there's only one thing to do. And in my opinion, that would be to work on strengthening it. And things
exercising
like it, and things like Ben Wobbles, or, you know, whatever exists in the world, because it's like, yes,
it's a muscle.
It is a muscle, and we need to use it.
Yeah.
Otherwise,
otherwise you lose it.
Exactly. No, for real.
I know. I've been hearing that from my
funny story. Every time I'm at a red light, instead of being upset about being in traffic, that's a perfect opportunity to do a couple of Kegel exercises. Just saying.
It is.
Yes.
Does anyone know if there are any studies or information about the effects of using cannabis on HPV or other cancers?
With chronic viruses and cancers, there is some research, but I have it for HPV and cervical cancer. I know that there were some medical patients here in Oregon that were using suppositories, and it was in combination with conventional treatments as well. So this is where it's like a brave new world in terms of we're going to be seeing so much coming out, and it's really exciting because it seems like a very reasonable treatment option. In fact, with suppositories, there were a couple of companies up until a few years ago. I knew they ran into some trouble with FDA and stuff. So some of these products are no longer on the market, but they were amazing at treating various things, because there's things called escharotic treatments and alternatives to like LEEP procedures and stuff for HPV related cervical cancer. And then we would do this thing called a vag pack, where you put all these herbal suppositories in after an escharotic treatment to help nourish and restore and heal the cervix, but they're no longer available. So hopefully we'll be moving more into that direction with research as it opens up and states start to invite more cannabis and research.
Well, it is a discouraging, particularly for women who aren't in legal states, even to get the things that exist. So here's one. My CBD oil does not have THC in it, but it has added terpenes. Would this be okay to use vaginally, or should I get some without the additional terpenes? I go back to what I said before. Get the stuff that's made for where it's supposed to be, and that will be much more likely to be compatible. But again, I would also say use patch test. Try a little bit before you try a lot of it, because you could have some kind of adverse reaction. I do know that I've had some adverse reactions to things that were added back in, or things that were mixed with other herbs and things that weren't compatible for me in a CBD oil, which should have been an anti-inflammatory, but then wasn't, because it was more irritating with whatever else was in it.
The thing with the additional terpene content too, just because terpenes can be antimicrobial, it depends what the source is. And depending on how much they're putting in, that could throw things off to vaginal balance. That's something I would consider.
So somebody was asking about high CBD content or CBD only suppositories. They had tried a THC suppository. It felt awful for them. They felt a burning sensation. THC, again, everyone's very individual, shouldn't be burning. It could be something else that it was made with.
Yeah.
But CBD suppositories, I'm sure there are CBD suppositories on the market now. While you're talking and answering some more questions, I'm going to go do a quick search.
So I'll read this one. My CBD oil doesn't have THC in it, but has added terpenes.
That was the one we just did. We just did that one.
Would this be okay vaginally?
Yeah, we just did that.
No, you talked about one that where she was saying it was burning. I think that was.
No, that was the next one.
Okay. There's two of them. There's two of them.
Okay. Yep.
Yeah,
so maybe it was.
Yep. So she's talking about, should she get something without the additional terpenes? Does it matter?
Right. Yeah, that's what we were just talking about. Yeah.
Oh, I'm sorry.
Yeah. Okay,
I would try without.
There.
Yeah.
Yeah, I would say try without the additional terpenes. Try something else. Yeah.
How about this one? I am trying to find either THC or CBD to reduce symptoms of menopause. I have been in menopause for 9+ years. Symptoms including lactating, hot flashes, random menstrual cycles.
Lactation, I would say, like, that's abnormal. And refer to a doctor.
Yeah, interesting. Yeah.
But
in
context,
that's a really good point, because I have never heard of that myself. But in general, THC, CBD, cannabinoids can affect you and be effective in reducing some of the unpleasant symptoms of menopause. That would be the simple answer, right? I mean, it can be helpful, but you pointed out that this person should really go see somebody.
Absolutely.
So there is a company called Foria. They have THC sexual wellness products and CBD only. Their CBD ones, I believe, are called Awaken, and they do have other herbs in them. They have a very pleasant, almost chocolatey scent. And that is a CBD only. And it says it's called Intimacy Suppositories by Foria. And they've been around for quite a while. I don't know if anyone has any opinions one way or another about them.
About Foria in general?
Yeah.
I haven't used them. They're California based, right?
They're California, yeah. So we have to just go travel to the different states.
Yeah, exactly. Next field trip.
So somebody's talking about strains. Seems like sativas are usually recommended as aphrodisiacs. Kimbo Kush, Dirty Girl, ATF, etc. But when I use them, I can't sleep for hours after. Will I always need to choose between orgasm and sleep? Well, that's if you're smoking, consuming.
Yeah.
Maybe try a few of the other forms.
Topical.
Topical, yeah, THC topical, very effective.
And also, I hate to chase strains because as we're starting to learn, strain names can vary grower to grower in terms of what's being produced. So it's important we're looking at cultivars in totality, kind of like we look at the whole person, right? So it's like we're looking at terpene content, not just THC, CB numbers, or strain name, because those terpenes definitely modulate the effect of cannabis. You can have two strains testing out at 22% THC and, you know, they have completely unique terpene profiles and therefore they have a different effect on us.
Right.
So, you know, not only versatility in how we're using it, but then also what exactly we're using, because maybe some of those terpenes are contributing to that overstimulation in terms of energy level.
Good point. Really good point. So I think we've gone through a lot of the questions. I'm really glad that we were able to get to more of the questions. At this point, we're already past the hour, but I have a couple of more things. We're picking a winner for the prize, and I wanted just to wrap it up so we can stay on video. I'm just going to pull the slides back up. One moment. And let's see, move back down to winner time. Have you picked a winner, Erica, for Molecular's Vela?
Sounds fancy. Winner, winner, chicken dinner, Lizette C. You'll be receiving an email from me tomorrow. Congratulations.
Okay, Lizette, congratulations. And again, if you're in Canada, we'll send you something else because we cannot ship overseas. And special offer, everybody, My Jane. Thanks again to My Jane for really supporting us, supporting women, supporting education and empowerment of women, and putting together these great boxes of products. And here is your code, Ellementa15 will get you 15% off. Again, this is the romance box. You really should check out that romance box because it's got a lot of the products. These are CBD products that we've been talking about, the different types of products. So take a look at that, myjane.com, Ellementa15 to purchase your romance box.
Great.
You're also going to get a recording of this webinar. It usually comes about a week after. We do a little bit of light editing to take out all the bloopers, and you'll be able to watch it over and over again and share it with everyone you know and love. Also, we've started something new. We're going to be doing little text messages of discount codes to quality products from companies that we absolutely love, and a couple of other little tips and tidbits. If you are preferring to get your information by text, you can just text Ellementa to 41242. Yay! And I mentioned Emma Chasen is coming back to talk about cannabinoids and to introduce us to some of the new ones that have just been recently identified. So this is going to be quite exciting to learn about that. You can join our groups at Ellementa.com/groups. We're on a bunch of different Facebook groups. Ellementa.com/gatherings is how you can find out about our in-person gatherings. And then we're all over social media. Dr. Sheena, how do we find you on social media? Where do we find you online?
Social media. So my website is merkabanaturalhealth.com. And then a very passionate project of mine is Protanicals, which is protanicals.com. And it's exciting because it's the first physician formulated product line to market, definitely in Oregon, maybe in the country. And yeah, so you can check me out.
Tell us a little bit more about Botanicals.
So I started formulating cannabis and botanical products in medical school in 2008. And as I was looking for alternatives to pharmaceutical interventions for anxiety, weird, medical school, stress, anxiety. So I started formulating some products that I was using at home, and they were really working well. And then as things became legal and I started practicing medicine after I graduated, I focused on cannabis therapeutics the first 5 years I was in practice. And there hadn't been any products like this that were like medically minded to really support people in a holistic way. And yeah, so you can, the handle for that is on Instagram as well.
Botanicals.
Botanicals.
Excellent.
Yes.
Well, we're at the end of our webinar. Thank you for those who have stuck around, and for those who are watching the recording, thanks for being here. We're at Ellementa.com if you want to find out more about cannabis and CBD for health and wellness. And Dr. Sheena, what is your website address? Again, could you spell it out?
Sure. For my practice, it's Merkaba Natural Health, MERKABA Oh,
MerkabaNaturalHealth.com.
That's totally a blooper. That's not fair.
That's staying in here. That's staying in. So, but it's Merkaba, is MERKABA. That was what I was wondering.
Yes.
Botanicals,
TANICALS.
Got it. Okay.
Yes.
.com.
Yes.
Making sure they can find you.
Thank
we'll also
you,
be
Lisa.
sending an email with all of this information to all of you who have registered. Thank you so much, Dr. Sheena.
Thanks so much for having me. I appreciate it.
Thank you. And Erica, thank you for the magic.
Thanks for the support.
You're
Seriously,
yeah,
you made it a pleasure. Thank you so much.
Welcome.
All right, and thanks to everybody who was here attending with us. Feel free to email us, get in touch in any way you'd like, and we're here for you. Here's to your health and wellness. Thank you. Good night.
Thank you. Good night.